Hi everyone, my name is Bruce Bassi. I'm an addiction and general adult psychiatrist with Telepsych Health. I see patients around the country in multiple states virtually via online visits. And today I'll be talking about what happens during a drug overdose, specifically during an opioid overdose. So let me just say up front, if you suspect somebody is currently overdosing on an opioid, you need to take them immediately to the ER. Either call 911 or drive them immediately to the ER. So when somebody takes an opioid, it affects multiple areas in their body and in their brain. One of those areas is called the pre-Botzinger nucleus, or pre-Botzinger complex. And so that is essentially the respiratory pacemaker. And when somebody takes an opioid, it slows down that pacemaker and it makes their drive to breathe less. It also affects the chemoreceptors around their vessels so that when your carbon dioxide level rises and your oxygen level falls when your breathing is slowing, your brain doesn't have that reception and understanding that you need to breathe more and blow off that carbon dioxide and oxygenate your body. So that leads into respiratory depression and eventually death. So the main way that you're going to recognize that somebody is currently overdosing on an opioid is that their respiratory rate is going to slow down. The typical respiratory rate for somebody is once every 3 to 6 seconds or so, about 15 to 20 times per minute. But if you just check over the next 10 seconds, they should have breathed maybe a couple times by that point. So if they're breathing less than twice every 10 seconds, that means that their respiratory rate is already slowing. So if it is actually slower than that, more than likely they're already suffering from some anoxic brain injury from hypoventilating. So the first signs that you'll notice when somebody is currently overdosing is that their breathing is slowing, or maybe they're not breathing at all. Maybe they're making snoring sounds, or they're choking, or their breathing is very irregular. They could be throwing up, which is very dangerous to their breathing as well. Or they might have blue lips or blue nails. Their skin could be very cold or clammy, and they might not be responding to a painful stimulus. So for example, if you squeeze their finger, or if you take your knuckles, make a fist and you rub your knuckles on their sternum, they should respond to that in some sort of meaningful way. And then finally, you also can check to see if their pupils are really, really tiny, and we call that pinpoint pupils, and that's one sign of an opioid overdose as well. So the first steps that you'll want to take when you notice that somebody has these signs, they're not breathing as quickly as they should be, they're not responding to pain, is that you want to first call 911. You want to get them on their way. And then you want to administer naloxone. And so that's the most important, critical thing that you can do when somebody's currently overdosing. Naloxone is an opioid blocker. And so all those opioid receptors are currently completely saturated with opioids. And so the naloxone blocks those receptors, and so it reverses the effects of the opioids. It's the opioid antagonist. And so after you've administered the naloxone, which can be delivered in a few different ways, but hopefully you have one handy and you've already read the instructions on how to do so, you want to start rescue breathing. And so you want to give them a breath once every 5 seconds. That's about the normal breathing rate that they're supposed to have. And so you'll want to give them a nice slow breath and make sure that their chest is rising and falling once every 5 seconds until 911 comes. And it's also important to keep in mind that after you've given them naloxone, they may become aroused and very irritated and aggravated. However, you have to realize that the naloxone will only last about 15 minutes or 15 to 20 minutes. And so it may be very likely that the naloxone will wear off, but the opioids will continue to last beyond that time frame. And so you'll end up back to square one where they're, again, unresponsive, even though they received the naloxone. So you have to remember they still need to go to the ER to get evaluated after they've received naloxone. In fact, that probably even further supports the need for them to get additional help. So say you have a friend in front of you who's not responsive, but you're not entirely sure that what they took was an opioid. It maybe was some other tablet that was described as Xanax or ecstasy, but they're still unresponsive. So what do? You should still give them the naloxone anyway, because it's very likely that what they took was probably cut with some sort of opioid, and the naloxone will be life-saving to that effect. And so if they did take a pill and they're unresponsive, give them the naloxone anyway and still call 911. So what are some sort of myths that people often come to me with? Well, one thing that I often hear is that people think that they can predict when they're going to overdose and if they're not going to overdose, because they'll think that they've been taking a consistent amount of heroin, for the last few months, and they know what to expect, and therefore it's not likely that they'll overdose on something. Well, it is very possible that the pill or the substance that they got is cut with an opioid that they don't even know. So it's not possible for you to predict the amount of fentanyl or carfentanil that's in a substance or a pill, because if you didn't pick the pill up directly from the pharmacy yourself and know that it's completely legit, it can be a fake pill that has an entirely real looking stamp on it or even engravement of certain numbers, and that can be cut with fentanyl or carfentanil. So people from the street, they can buy pill machines essentially and have it look entirely legitimate, and you don't know exactly how much fentanyl or carfentanil is in that pill. One other misperception that people have about overdosing is that they think that they have a chance to call 911 themselves. You won't have a chance. It will happen too quickly. It's going to impair your judgment. It's going to impair your thinking. You won't be thinking clearly. All you'll perceive is that you're just falling asleep, and you won't suspect that you're in any danger. You think you'll go to sleep, but you're actually in the process of overdosing and dying. So to review, the same amount of heroin or pills doesn't guarantee that you're not going to overdose. There might be a small amount of fentanyl or carfentanil mixed in unbeknownst to you, and it could be a very, very small amount. So 0.3 milligrams of carfentanil can be a lethal dose, which is just a tiny little speck if you Google what that looks like, and you won't even know by looking at it or by smelling it that it's any different than what you've regularly taken before. And it is true that some sort of dealers actually intentionally put fentanyl and carfentanil out in their product to prove that what they are selling is the most potent stuff around. And so they'll actually take pride in knowing that people have overdosed. I mean, they're not thinking clearly. It makes absolutely no sense to be intentionally killing people with overdose, but that's what people think. I hope that this video describes the very real dangers of using heroin and other pain medications, and I hope that this describes to you how important it is to seek help by calling 911 immediately and taking your loved one or friend to the hospital immediately, having naloxone on board. You can ask for a prescription of that medication and pick it up from a pharmacy if you know that you'll be using in the future. I'm Bruce Bassi with Telepsych Health. I see patients in numerous states via online virtual visits, and thank you so much for your time.